Hello, my name is Isabel Alonso, and today I will present the past, present, and future of public health for this critical assignment presentation. What is public health? Public health is the science of preventing disease, promoting health, and protecting the public against health risks. The philosophy of public health is to prioritize health and protect against risks to improve the lives of all people. Some core values are social justice, accessibility, prevention of risk factors, and creating a mentally and physically healthier population. Social determinants are the circumstances in which individuals grow, live, are born, work, and their age. These are based off access to resources, including money and power at the global and national level. The availability of these resources have a positive impact on community, although there are limitations to this that are difficult to measure and that it does not have a role at influencing policy determinants. For example, looking at neighborhood and built environment, the social determinants would be unsustainable housing, lack of transportation, poor access to education, healthcare, and jobs. At the County Health Rankings Model provides a reliable and sustainable source of local data about health and its determinants. The arrows on the left side represent community and society policies and programs that affect health factors, which affect health outcomes. The right side contains health factors which are measurable. Social determinants of health at the social and ecological model. The social ecological model includes biological factors. This model demonstrates the relationship between different policies and programs. It also describes the relationship between factors and chain of causation. These include the interconnection between individual, relationship, community, and societal factors. For my example, prevention of violence. At the individual level, biological and personal backgrounds are crucial factors to consider when determining the likelihood of being a victim or perpetrator of violence. Age, use of substance, or history of abuse are important factors to prevent violence at the individual level, can be to promote resolution skills and social emotional learning skills. At the relationship level, relationships between close families, friends, and peers influence their experience. Promoting healthy relationships by strengthening family relations, family therapy, and peer programs. In the community, settings such as school, work, and living environment, social relationships form in these environments and need to identify what characteristics these environments are associated with becoming a victim or perpetrator of violence. In the societal level, this includes factors in society and encourage or implement violent behavior. For example, places in which violence is encouraged to resolve problems. Health equity and Christian perspectives. Health equity is when every individual can attain his or her full potential and no one is disadvantaged from achieving this potential because of social position or other socially determined social circumstances. The goal is to get rid of health differences and have the best health for the population. Everyone should have the health opportunities to be as healthy as their body allows. This requires making issues such as discrimination and poverty less prevalent. Education, good incomes, and safe environment should be more accessible. To solve this, finding crucial health differences, lack of fairness with resources in society are a factor in keeping individuals from reaching their full health potential. Policies and laws should be made to decrease the inequity in these opportunities and resources, employing short and long-term measures to monitor efforts because it will take time to decrease these health differences, and planning and assessing next steps of action to learn from processes and outcomes. Health equity relates to Christian values because Christians work to fight injustice in communities. Christians believe in equality and fair opportunities for everyone, and their faith revolves around treating their neighbors with kindness and as they would like to be treated. Jesus promoted a healthy lifestyle in spirit, mind, and body, and Christianity works to save people from their unhealthy lifestyles, which is a similar goal to maintaining health, as we see in public health. Roles of governmental institutions. The federal government is limited in power to promote and give general welfare and regulate commerce. After 1935, the federal government had the ability to apply financial pressures on local and state programs. States were powers with rule over health that came from police powers. The government was expected to help individuals that were unable to provide for themselves. Structures and organizations were made by states so they could use police powers to protect individuals from communicable disease and hazard. Federal government was more involved after state power started to wear off. The roles include population growth, and shift over time. The Affordable Care Act helped the federal government to strengthen its capacity to affect the public health system with its fiscal power. Within Department of Health and Human Services, there are public health service agencies and CDC. They address many public health activities. They provide leadership, policies, give financial resources, along with other roles. Other agencies are the Department of Agriculture and Agency Impact Health, and these are the roles of governmental institutions. This model is the HHS organizational chart. This model shows how the Department of Health and Human Services is set up. It is managed by the Federal Health Department. It shows how it is managed and how it works. Roles of non-governmental institutions. They have contributed to public health outcomes in a positive way. Components that play a major role in public health are education, media, healthcare delivery systems, and communities. The influence of the social determinants of health has made states and localities put a health in all policies approach to policymaking. Health in all policies finds way that policies and sectors can improve population health. They also help with job stability, neighborhood safety, and transportation. Governmental and non-governmental agencies work together to implement policies that benefit the public health of communities. The three core public health functions are assessment, policy development, and assurance. Assessment is systematically collecting, analyzing, and making available information on health communities. Under the assessment function, there is monitoring health and diagnosing/investigating. The next core function is policy development, and that promotes using scientific knowledge based in policy and decision-making. Under this function, there is informing, educating, empowering, mobilizing community partnerships, and developing policies. Under the assurance core function, it means to ensure provision of services to those in need. Under this function, there is enforcing laws, linking to/providing care, assuring a competent workforce, evaluating, and research. Public health professionals work with global organizations to improve the health of everyone. There is a common goal nationwide to improve the health of all. In this public health history timeline, I have included several moments in history that affected public health. In 1500 BC, Leviticus is believed to be the first written health code in the world. The Code of Hammurabi, created by the king of Babylon, is one of the earliest sets of laws found. It shows rules and punishments if those rules are broken. In 500 BC to 500 AD, Hippocrates was the founder of Western medicine, and the Romans improved upon Greek engineering in the building of aqueducts to protect water supplies. They also created the first hospital. In the 500 to 1500s Middle Ages, the Renaissance, there was a rebirth of thinking about nature and humans. Careful accounts of disease outbreaks were made. In the 1700s to 1800s, growth in industrialization that brought more and more people to cities in search of work, while this led to overcrowding and poor sanitation. In the 1800s to 1900s, tremendous advances in the understanding of health and medicine. There is acceptance of link between environmental and health forces. In 1920, Alexander Fleming discovered penicillin while studying molds. This discovery would be one of the most important discoveries of the 20th century for its ability to kill bacteria and fight infectious disease. In the 1980s to 2000s, smallpox was eradicated in 1980. The Nutrition Labeling Education Act was signed into law, and the Top 10 Public Health Achievements of the 20th Century was published. In the 2000s, Healthy People 2010 was published. More than 23 million people died from AIDS since 1980, and The Future of Public Health was published as well. Public health limitations. Many individuals in the U.S. do not have access to health care because of lack of insurance, cost of care, little health care services, and lack of culturally competent health care. Because of this, their health needs will be unmet. Delays in getting care and inability to get preventative care may lead to financial burdens. There are racial and ethnic disparities included in this. White people tend to receive better quality health care than people of color. Social determinants such as income, education, housing, and employment also affect access to health care. To solve this, it is important to improve access to healthcare services. There should be more diversity in the workforce of healthcare. Addressing health conditions that affect minority groups and other social determinants is crucial. Healthcare providers should be trained in cultural competency. To change health equity, there must be a change in policies and systems. The OMHHE works to standardize the language and principles of health equity, analyze and use data to evaluate health equity and manage public health programs, contribute to a national survey to see the status and impact of sexism and gender-based racism in the U.S. population, develop and communicate strategies and to decreasing sexism and gender-based racism in the workplace. Work with the CDC to address health inequalities, health disparities, and the structural and social determinants of health in response to public health crisis, and design new or improve existing evidence-based strategies to address health equity and persistent health inequalities, implementing these strategies in diverse communities. Discuss what policies should be implemented to decrease public health disparities and how to improve public health. Public health achievements in 25 years. I think it is very important that the issue of chronic illnesses such as heart disease and obesity are significantly decreased. I believe it is important to help decrease this issue because it is a leading cause of death in the U.S. According to the CDC, obesity decreases the average life expectancy and quality of life. Premature heart disease are preventable by 80%, and promoting healthy lifestyles can prevent heart disease. Healthy community design are built to improve the lives of people in that community. I think it is important to make parks, bike lanes, greenery, and other resources to make neighborhoods more walkable. I think schools should improve physical education and encourage healthy eating habits and promote healthy eating areas. According to the National Library of Medicine, there is a weight bias and healthcare professionals should be educated in factors that lead to obesity. I think they should also be trained on how to communicate with patients without bias, communicate weight management, and not use language about obesity that will unmotivate the patient. What do you think will be the biggest public health achievement in 25 years?